David, we've been so excited on Mind Your Health to chat with this young man. This is Dr. Brandon Runyan, and he is a radiologist. But one of the things that he's an expert in is artificial intelligence and AI. And we've been chatting a little bit before, Brandon, about not just artificial intelligence medically, but how it can impact your overall health and wellness. So a couple questions for you to get us started. I know you've got the one you've been dying to ask.
Yeah, so AI is a great subject. You see it across all things. They're talking about traffic lights and, I was thinking about healthcare. How can we use AI in radiology, is one part. And then how can we use AI to remain healthy, to prevent issues down the road?
Yeah, I think it's an interesting question. As far as like thinking broader about AI, we had to think about kind of taking the good with the bad and trying to understand how it's going to change things. One example of how AI can help with prevention is specifically with mammography. So there are studies looking at AI tools that actually showed that AI was more predictive for future breast cancer. So not only is it able to assist in the detection of early breast cancer, but it can actually assess the overall risk stratification for the breast. So the breast you can stratify that risk and be like, oh, this breast has a 90% chance of developing breast cancer within 5 years. Now, those studies are retrospective studies, so where they looked at mammograms that have already been performed, where they already know the outcome. We don't have the prospective trials or the prospective look to see how it performs in the real world. But it certainly is something that makes you think like, oh, wow, this is going to give us the ability not just to detect disease in a paradigm that we're currently familiar with, but it also is going to give us a way to detect maybe future disease states. And I think that because AI can look at a really enormous amount of data in a different way with kind of a different perspective than what we're used to, that it's really going to open up a lot of different possibilities for the way that we can view healthcare and wellness moving forward.
And going back to what you asked, that's the prevention piece right there. If AI can predict, I mean, that's almost a prophylactic or preventative kind of
right. And so prevention, and that's truly prevention. So if you detect a breast cancer early, that's early detection. It's not really prevention. But if we're able to kind of get ahead of a potential future disease state, that's a separate question.
So dumb it down for me. If you're looking at a breast exam and you're using your eyes to look at that, is that what you're basing this on, as opposed to no, the computer is going to look at that same exam?
It is, yeah.
And just because it can collate so much information, it's going to give a better prediction that are just...
I believe it is. I think that there's a lot more information on the images than the human brain, and we're kind of stuck in this human brain mindset we have here for a long time. I think that with AI, part of the excitement and terror of it is that it's going to really exceed our capacity to deal with information, and it's going to get a lot more information from the same data sets that we currently get, and maybe even can extrapolate more information from even smaller data sets.
What does that mean? Say that in real.
So if currently we have like 2 images per breast, so 4 images per breast, and then we have tomosynthesis, which takes like a scan of the breast.
Okay.
Gives us like 100 images per breast on each side. So we're actually looking at about 400 images for mammogram, tomosynthesis mammogram.
The tomosynthesis mammogram up where?
We'll come back to that in 2 seconds.
I'll say fine.
So let me just finish when I say a smaller data set, the AI might be able to take 1 image per breast and extrapolate everything in both views. So everything right now is geared towards my ability to detect.
Okay.
With AI, because the detection tool is different and it can use the whole information set without having to get that same images. So what is tomosynthesis? Tomosynthesis is a 3D mammogram, it is described. And that's where we take a sweep of images across a breast so that we're able to kind of divide it into sections and look at...
Almost like slicing bread?
Almost like slicing bread. And allows us to look at individual sections of the breast.
So how about, now, I don't know a whole lot about, breast abnormalities, but are there densities and things in the breast that may or may not be cancerous? Does the computer understand that that's a... fatty deposit, or that's a something and not
like a nuance thing.
correct?
That's a great question. Because you really, I think in mammography, I think it's interesting because we actually have been using AI tools for a long time, for decades. Like really, we've had computer-aided detection in use for mammography for a long time. One of the limitations of it has been that it's not very precise. So it's not great at detecting the difference between them. And it really needs us to better differentiate. That is, I think, changing. So one of the things that's happening with AI is because the models that they're using now are getting so much bigger they're getting much more accurate. And now their accuracy is starting to rival and in some studies even exceed the human's capacity to interpret. That said, I think it's a little bit like having autopilot on a plane where you still want the pilot there because the ramifications are really important.
That was my question is AI as good as the data or input it was given? In other words, as a physician or other physicians, do you teach AI initially and then it sort of takes a life of its own?
We don't, yes, the answer to the question is yes.
Okay.
But those models have been developed using patient data, large, enormous sets of patient data in the past. So it's not like I'm training my AI now.
Okay.
Instead, it's more like those AI models have been trained over millions of mammograms over years.
Got it.
And then now those models are getting to a point that they are able to auto-refine over time.
So how does it play together? How will the physician, the person, and the AI actually play together to help my health, right?
I think this is like the question for whether AI will be a net positive for humanity or a net negative for humanity. Okay. So I think that on the positive side, AI opens the possibility to, instead of having doctors staring at a computer screen, trying to record and collate data and focus on the collection of data bits, instead the physician can focus on the person. And I think that there is an opportunity to have a increased human interaction with healthcare, to have the data taken off of the technical side. And that is a big shift from where medicine has been over the last 50 years, which has been more and more technical, more and more detail focused when it comes to how we look at data over the patient.
And that's so interesting because, when I had a mammogram, I really want to talk to the doctor. I really want to talk to the technician, but they're busy reading and gathering the data.
That's right. And I think that on the productivity side, if we are able to get to the point that, it's functioning smoothly, that we have a good relationship with it, then the AI tool will augment our ability to deliver healthcare in a positive way. And now there is a risk that it could go the opposite direction too.
You're not longer needed because...
Right. Well, and not just me, but
not you, but
any physician. Yeah. Because you could, in theory, have somebody with not an MD, not the residency, just get a printout and be like, okay, well, this is what you have. Yeah. Or you could even take the position out entirely.
But the computer, so let's stick with breast cancer. The computer's not looking at family history, right, and genetics. The computer's not looking at lab values and all that, and just physical exam and all those kind of things, right? And the physician collating.
Well, by definition, it can't do the physical exam, but it can do everything else.
Oh, it looks at labs?
It can definitely assess a pretest probability. So when we think about diagnostic exams, one of the key things that we do think about is how accurate it is. And its accuracy is dependent on what the probability of there being a positive result is in the beginning. So that's the pretest probability. But definitely the algorithm tools are getting to the level of sophistication that they can take into account.
But you know what I view it as? Isn't medicine art as well as science, and the human element and the personal connection to the person that's treating me is equally as important to what I am diagnosed with or how I interpret that?
And I think that is, I certainly agree with that perspective. I do think that is a nostalgic perspective of what
is that
medicine is. No, I mean, I think it's kind of like
in their AGB.
And I do think not just for radiology or physicians in general, I think that there will be kind of a nostalgia like we still are going to want to see the person in the white coat with the stethoscope.
Got it.
Even if everything is kind of done through a blood test and, a simple, put your finger into the AI detector machine. And even if we have robots that are able to go through and clear abnormalities, I think we're still going to want somebody there to supervise that treatment. And I think that the trust is the big thing that is going to be a challenge for AI. There's going to be a time where we do trust it to be even better than a person, and that could be closer than we think, like within the next 5 years.
Okay.
But I think that the trust side of it, going back to my example with an airline pilot, like we still trust that if the pilot is there, that they can deal with
I want to see the physical pilot sitting in the pilot seat.
And currently the limitations with AI have to do with uncertainty and trying to understand the limits of that uncertainty. And I think humans have done a better job with judgment. And so like judgment being kind of like that critical differentiator, not just for medicine questions, but for other types of questions in general. So thinking about what Kiki, my sister, does too. Like, so she uses AI tools to interpret data, but she can tell if that interpretation of data is off and she can correct the prompts. So that interaction between the two is really much richer because she's able to assess data much more critically and more data sets in more different ways with more different.
She's an environmental scientist and
professor
and maps. It's coast.
Yeah, she maps coastlines and does a lot of work at
sea level, sea rise, all kinds of stuff. Well, just to put it in context.
Yeah, sure. Absolutely.
Or we're in trouble if AI becomes TV hosts or we're podcasters.
But it actually
turn you away.
It can actually do that. So the AI tools are actually, you can plug in, you can tell it what to do. It can create people, it can create voices. It can take your voice and image and likeness, and you can kind of create content that way. So that's how sophisticated the tools are getting. Yes. And a hard thing to wrap our brain around is not just what it is now or what it was 6 months ago, but what it will be in 2 years, because the rate of change is exponential. And I think that one of the limitations for humans is that we have difficulty imagining what the exponential could really look like.
Oh my God. And on that note, I think we're going to take a break. We will come back and chat with you another time. It's so interesting how these conversations sort of take a life of their own. And I think when we're talking about artificial intelligence, there's just so deep, such richness, so many questions.
It's going to touch so many different aspects of life.
Brandon, thank you for joining us here on Mind Your Health podcast. Thank you all. Stay with us.
Mind your health, mind your health, mind your health, mind your health.